Hi, my name is Wilma. I'll be your student nurse today, and today we're going to go ahead and conduct a head-to-toe assessment on your newborn baby. Congratulations. What's your baby's name? Oh, baby Lisa, that's a great name. So we're going to go ahead and do an overall assessment, make sure baby Lisa is okay, check her from head to toe, make sure her reflexes are good, make sure her belly's good, her heart's good. Do you have any questions before we start? No? Okay. Go ahead and apply hand hygiene. I'm going to go ahead and do that. And while I grab all of my equipment, I've got my gloves that I'm going to go ahead and place. I've got my stethoscope around my neck. I'm going to go ahead and grab my pen light as well. And for today's assessment, this pulse ox is going to be my measuring tape, so I can measure her head circumference and her chest circumference. Okay, so we're going to be looking for a few things with baby Lisa. Baby Lisa was just born yesterday around 5 p.m. Overall, her color is great. She's got a pink color. She's moving her arms and her legs well. Her posture is flexed. Let's see what else she's got. She's got spontaneous movement going on, which is great. We're going to go ahead and start off with some measurements. First, we're going to go ahead and weigh baby Lisa. So normal weight for a newborn is around 2,400 to maybe 2,500. I misspoke. 2,500 to 4,000 grams, and baby Lisa is coming in at 2,700 grams. Normal length for a baby newborn is about 48 to 53 centimeters, and we'll go ahead and measure her. So we'll start from the top of her head and we will extend her legs. We'll just pretend that her legs extended and her centimeters at, oh, she's a perfect 50 centimeters. We'll go ahead and measure her head circumference. To measure her head circumference, we'll go from the back of her head, raise her head a little bit. Take one piece of the measurement, pop it on the other side. Normal head circumference measurement is about 32 to 36 centimeters. She's measuring right around 34 centimeters, which is perfect. We'll go ahead and take this same measurement, we'll lift her up a little bit, and measure her chest circumference, making sure to get underneath her little arms, right above her little folds. So our normal chest circumference measurement is about 30 and a half to probably 33 centimeters, and hers is perfect 32 centimeters, all within normal limits. That is perfect. So her measurements are great. Baby Lisa is doing great. Then we're going to go ahead and do a respiratory assessment, check her breathing. I'm looking at her chest right now. It's rising and falling equally. And she doesn't have any audible wheezing or her breathing normally for a newborn is about 30 to 60 respirations. We'll go ahead and listen to her for a minute. We're going to go ahead and use this bell of the stethoscope, or a pediatric stethoscope. The reason we do that is because if we were to use an adult size stethoscope, or not the bell of the stethoscope, being that baby is so small and everything is right there in that area, it'd be really hard for us to differentiate bowel sounds from heart sounds and lung sounds. So we'll go ahead and listen. We're going to go ahead and make sure we listen for a full minute. Yeah. Equal rise and fall. I'm actually going to do that for a minute. Okay, it has been a full minute that I have observed baby Lisa. Not only did I have my hand on her chest to feel for the rise and fall, but I was also observing for a few symptoms of respiratory distress. The few key features or key symptoms that we want to go ahead and look out for. We want to look out for like chest retractions, uneven rise and fall of her chest. We want to look out for any cyanosis, which will be present in her fingers, toes, around her mouth, which is called oral cyanosis. We would be looking for that. We'd be looking for nasal flaring, her nostrils going in and out quickly. We'd be looking for fast breathing or any pauses in her breathing, and she does not have or exhibit any of those symptoms, which is great. So I've already explained why we're using the smaller stethoscope because of the baby's compact size. Let's see. She is not a C-section baby. She was born normal vaginal. We want to go ahead and just make sure for C-section babies, they may have retained some lung fluid because during childbirth, when they're expelled vaginally, mom's uterus does its job of contracting everything and kind of getting the secretions out. If baby was C-section, it'd be hard for her to do that. So we'd watch out for that. Next, we're going to go ahead and listen to baby Lisa's heart rate. For a newborn, we want to go ahead and listen to the heart rate for a full minute and ably. Usually for the baby, you want to go ahead more laterally on the left side. And we're going to feel for like the third and fourth intercostal spacing and listen there. And we're going to go ahead and listen for a full minute on that. It's hard because baby Lisa's so small. All right, so we've counted down 1, 2, 3, 4, and a full minute. Okay, it's been a full minute. We went ahead and checked. So normal heart rate for a baby is anywhere from 130 to 160. Baby Lisa's heart rate came in about 134, 135, so that's good. We're going to go ahead and check her pulses, both femoral and also brachial as well. When we're assessing that, we want to go ahead and check pulses bilaterally at the same time. And see if everything's okay. So we'll go ahead and feel for baby Lisa's pulses, making sure not to feel with our thumbs. So they're strong and equal. I've got about normal rhythm, about 2+ pulses as well. So that's good. So vital-wise, she's doing okay. We're also going to check her temperature. Let's just say we checked her temperatures first. So normal for a newborn is around 97.9 to 99.5. Baby Lisa's at 98.4. We went ahead and did either rectally or axillary. We're also going to go ahead and we won't have to go ahead and do her blood pressure unless we're concerned with any cardiac issues, but normal blood pressure for a newborn is systolically anywhere from 65 to 95, and diastolically anywhere from 30 to 60. But we're not going to go ahead and do that because we don't have any issues, cardiac concerns with baby Lisa. Now we're going to go ahead and examine her head. So when we're looking at her head, we're going to go ahead and examine for her fontanelles, her anterior and posterior fontanelle. We're going to go ahead and make sure the positioning of her head, that it moves equally and everything is okay. There's no sunken or bulging feelings on her head, which could indicate, the bulging could indicate increased cranial pressure, and then the sunken end can indicate like signs of dehydration. Let's see, the anterior fontanelle would be a diamond shape, and then posterior fontanelle would be triangular. And they are good. We're feeling gently across her fontanelle, which is okay. Making sure to support her little neck. So that is okay. I do not feel any cephalohematoma that's like bleeding between the parietal skull and the scalp. I don't feel her head is equal, and I don't feel any swelling there. I do feel a bit of caput secundum. That's like just regular swelling from birth, from her traveling down the canal. That would resolve in a couple of days, which is totally normal. Then we're going to go ahead and move on to her face, which is her eyes, her ears, and her nose. So we're going to go ahead and look at her eyes. Baby Lisa's got a beautiful bluish gray color eye. We're going to go ahead and shine the light on her eyes. Babies normally don't have accommodation, so we're not going to go ahead and look for that. We're just going to look for Perla without the accommodation. So we're going from in out. Equal as rat. Pupils are equal, round. Beautiful. They don't accommodate, so I already explained that. Let's go ahead and look at her ears. I'm going to turn her head a little bit just to look at the placement of her ears. So her ears, the pinna is what we're looking for, to be equally aligned with the outer canthus of her eye. If it was low or high, that would indicate like genetic or chromosomal abnormalities. I'm not saying that with baby Lisa. Her ears are equally aligned with the outer canthus of her eyes. She doesn't have any preocular tags or any tags hanging out from her ears, which could sometimes be indicative of kidney issues during conception. Well, kidney issues. And then we're going to go ahead and just look at her nose. We're going to check her nostrils for patency, make sure she's breathing okay. How we do that is we go ahead and press one nostril at a time, and just to make sure she goes ahead and breathes in and blows out, kind of thing. So we're observing for breath. That nostril's okay. That nostril's okay. Perfect. Okay, now then we're going to go ahead and move on to her mouth. We're going to go ahead and check her rooting reflex. So how we do that is we stick a gloved clean finger in her mouth and see if she goes ahead and sucks on it, and make sure everything's okay. We're going to go ahead and make sure that her mouth is symmetrical. There's no signs of like any facial or nerve issues. We're going to open up her mouth and make sure the inside of her mouth is okay, and we go ahead and examine that, and we're seeing some Epstein pearls on the gum, which is like white little spots on her gums, totally normal. So we'll go ahead and do that. Baby Lisa is sucking really well, so she's grasped onto my fingertips, so that's good. We don't see any circumoral cyanosis. If we did see that, there'd be concerns for having like heart issues, but we're not seeing that. Okay, now we're going to go ahead and move on to her neck. So what we're looking for is her neck, just to make sure that there is like no clubbing in her neck, no webbed features in her neck. Everything does look symmetrical. We're going to make sure that her thick folds are okay, that she moves her head from side to side easily. So we're going to go ahead and do that. So I'll pick her up a little bit and just gently move her head that way. And then this way. And it moves easily without any resistance, so that's good. We'll go ahead and place her back down. We're going to go ahead and travel down to her clavicle just to make sure and feel like we don't feel any lumps or bumps sometimes during childbirth, especially if it's a hard childbirth. A baby can go ahead and fracture the clavicle during the passageway, so we want to make sure we evaluate for that. We run our 2 fingers across the clavicle. I don't feel any lumps or bumps there. No lumps, no bumps, no crepitus. So chances are no birth-related fractures. We're going to go ahead and take a look at her chest, make sure that it's symmetrical, equal rise and fall. It looks good to me. Cylindrical in shape. I do visualize 2 nipples, no excessive nipples, and that's fine. Everything is okay. We'll move on to her abdomen as well. Okay, sorry about that. We'll move on to her abdomen and examine that. We're going to go ahead and visually look at it first. It is round. We're going to go ahead and listen with the bell of the stethoscope. If baby Lisa was just born, sometimes we wouldn't hear any bowel sounds, so that's totally normal if we didn't. We'll go ahead and listen until we hear some bowel sounds and make sure everything's okay. We'll start off at her right lower quadrant and make our way up and down, and with an ending with the left lower quadrant. I'm not sure if I said we're going to do that with the bell of the stethoscope as well. So we'll go ahead and pop that here. Very active. We've heard like at least 10 so far. All right, we're going up a little. Perfect. 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 Baby Lisa's abdomen is very active. I think she just ate with mom, if I'm not mistaken. Then we'll go ahead and examine her umbilical cord, or her, making sure there's no hernia present, that her color is okay. We're looking for like a bluish gray color that gets even darker as the days go by. She has 2 arteries, 1 vein. I can see that. There's no bulging, no signs of any hernia, which is good. Now we'll go ahead and move from her abdomen, which is nice and soft and firm. We'll go ahead and move from her abdomen to her reflexes. There are a couple of reflexes that you want to check for in newborn. First one is the Moro reflex, which is the startle reflex. You're going to go ahead and hold on to baby's fingers. Make sure that she grasps it. And then once you let go, she'll get startled and jump. And baby Lisa did get startled, so that is a normal reflex. It is present. Her arms are extended and they come back when she is startled. Then we're going to go ahead and look at her palmar reflex as well. She did grip my finger with her hands, which is good. We're going to go ahead and observe for something that they say is a simian crease, which is a single crease on the palm of her hand. If there was one, we'd go ahead and monitor. It can be indicative of like Down syndrome, other issues like leukemia and other concerns. We went ahead and looked at that. She is good. She is okay on that. We did not observe one. Then we're going to go ahead and look for her plantar reflex, which is on her toes. We also want her to do the same thing that she did with her hands, with her toes on her fingers. So we'll go ahead and run that. And she is gripping my finger as well. Then we'll go ahead and to do a couple of other reflexes. Babinski reflex. We want her, when we run our finger down the back of her toes, we want it to grasp like this and fan out. And yep, baby Lisa is doing that. They curled in and fanned out, and that big toe is kind of just sticking up like that, which is normal. We'll move on to evaluate her for like hip dysplasia. First, we're looking to see her hips look symmetrical. Her folds look symmetrical as well. We're going to go ahead and rotate her hips in and out and observe for any clicks, feel for any issues as well and also feel for issues in her hips. So we went ahead and did that. No audible clicks are heard. And she is, yep, no webbing. She doesn't have any extra digits. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Correct. So no extra digits, no extra toes. We observed for the hip dysplasia, no extra clicks that were audible. And then we'll move on to her back and her buttocks. Now, when we're looking at her back and buttocks, I'm going to go ahead and lift her up. And holding that. Let's hold her like this. We're looking for her back and buttocks. Go ahead and put her down just a little bit. We're looking at her back. It is lined and straight. There's no bulging. We're looking for any like tufts of hair on her buttocks, and that can be indicative of like spina bifida or any dimpling in her butt ticks, any dimpling in her buttocks, which can also be indicative of like pilonidiosis. We do not see that. We see her sacrum is fine. Her buttock folds are symmetrical. Her legs folds are extended out, which is good. They're equal. I don't see any Mongolian spots, which is like bluish black or like a dark blue or black spot in appearance that usually comes over. It's a birthmark. It's totally normal, but I don't see it. At times it gets a little bit lighter, but it's not visible here. It usually fades over time. I don't see it. So we'll go ahead and observe that. She is good. She doesn't have any fissures that I can see. So that is a good thing as well. Okay, sorry. Her legs, her legs are equal in length. And they appear equal in length, so we'll go ahead and we've examined her back. Everything is good. Her tone is good. We'll go ahead and turn her around and place her back here. She's got a really good grip, as you can tell. So then the one last thing that we'll go ahead and look for is her genitalia. So with females, it's normal for when you separate the labia that she have some white discharge or thick white or pinkish discharge. That's just the mother's hormones that are excreting from her body. It's totally normal. We would observe for that. If she was a male, we'd observe for like her testes, his testes to go ahead and be descended. We'd look for any abnormalities with the penis. And then we've already checked her anus. We didn't see any fissures. Everything was all closed up. It was patent. So we'll go ahead and look for that. And I do see that she's got a little bit of discharge in there, which I said was normal. So we'll just go ahead and reassure you, Mom, that it is. And then everything's okay. Other than that, that is really it. Baby Lisa is checking out great. Her weight is great. Her appearance is great. I can hear her great. She's suckling. She's rooting good. She's doing all of these things, which is really great. Okay, Mom, so overall, baby Lisa is doing great. I'm going to go ahead and wrap her back up for you. Did you have any questions for me? She is looking fantastic. All Alrighty. Oh, come here, baby Alicia. And here you go, Mama. Here is baby Lisa. I'll put your call bell there. Any questions or any concerns, you do not hesitate to press that call bell and I will be here for you. Thank you. That concludes my assessment.